VDM India on the Move, a reputed NGO founded in 1993, involved in spiritual, social, economic reform. VDM India on the Move focuses its work in 6 important aspects: patriotism, clean and green, healthcare, women empowerment, skill development, and youth empowerment. In this program, our focus is on healthcare. This is to create awareness on the dreaded disease breast cancer, which our women is suffering in our country. In this regard, we have among us an expert, Dr. Jayanti Thumsi, who happens to be lead surgeon breast oncology at Apollo Hospital Bangalore. Let me take the pleasure to introduce her. Dr. Jayanti Thumsi. Dr. Jayanti Thumsi has graduated and completed her MS in General Surgery from Grant Medical College, JJ Hospital, Mumbai. She has undergone training in breast oncology at Tata Memorial Hospital, Mumbai. She has been practicing breast oncology in Bangalore for 21 years and has a vast experience. She has performed more than 3,500 breast surgeries and 2,500 other surgeries so far, with an expertise in breast conservation and breast reconstruction surgeries. She has keen interest in bringing about awareness in women about breast cancer and has been very active in conducting more than 258 awareness programs and has educated 4,58,000 women so far. She has done a number of TV shows, radio programs, written newspaper articles, YouTube videos, Facebook live programs, etc. She has authored a book, Lump to Laughter, which highlights the emotional journey of women going through breast cancer treatment with medically validated information. This book is already in its 3rd edition. She has been honored with Women Achiever of Karnataka 2019 by VRL Group, Vijayavani and Digvijay TV, Kengal Hanmantaya State Award 2019 for her work in the field of breast oncology and her contribution to the society, Chanakya National Award, Jury Special Award for Medical Inspiration by the Public Relation Council of India and World Communicators Council on 6th March 2020. She is a founder member and managing director of CREST Foundation, which is an NGO working on reducing the burden of cancer in our society. Under her leadership, CREST Foundation had collaborated and organized the world's largest campaign for breast self-examination, in which 2,332 women were taught breast self-examination in a single day. This event has a world record and has been recognized by Limca Book of Records. CREST Foundation has sponsored education for 3 deserving, meritorious but underprivileged students for completing MBBS. Dr. Jayanti has published many papers in various national and international journals. She has been invited speaker in many national and international conferences. She is also involved in many research activities and clinical trials. This interaction is conducted by our life teacher, Sri Acharya Ajit, founder of VDM India on the Move, who is working for the past 28 years for the welfare of the nation.
Good evening, madam. This is something very interesting for all of us, that in the series of eminent personalities VDM India on the Move want to introduce to this country as well as to the whole world, we have chosen you as our guest today, Dr. Jayanti Thumsi. She is a lead surgeon in breast oncology, and we will be asking very important questions which all of you would like to be asking her. On behalf of you, we will ask those questions and get those answers so that you have more awareness regarding this subject of dreaded disease, breast cancer.
Thank you very much for having me on the show, and more than having me on the show, I think what is important is the topic, and this is a topic where I think everybody should know, and why I feel that awareness is important about this topic, because it is actionable. This is one of the few cancers where we can look at completely curing it, provided there are 2 important things that happen. One is early detection, and second is appropriate treatment. Okay. So early detection is very, very important, and lot of it is in the control of our common people. You know, appropriate treatment is doctors like mine. The onus lies on us. But early detection, a lot of it can be contributed by our women in the society just by being aware and knowing simple things like breast self-examination and the importance of mammogram. And I really, really applaud that you have brought up this topic to help the people in our community. Thank you.
Madam, what is the percentage of people who are suffering with breast cancer, especially in India?
Right. Now, according to the latest World Health Organization statistics and the ICMR, it is estimated that India is going to be one of the major contributors for breast cancer patients, newly diagnosed breast cancer patients by 2030. You know, right now close to 1.5 lakh new cases of breast cancer are detected in our country. But of course, we also need to consider that the collection of statistics in our country is not at par with what we see in the other countries. But to give you some idea, about 1.5 lakh new cases are diagnosed, but unfortunately, about 70,000 women lose their life because of this disease. That means out of every 2 new cases diagnosed, one woman loses this battle of breast cancer, which is actually a potentially curable cancer.
Oh, that's great.
Yes, and just because of lack of awareness, lot of myths associated, and in our culture, you know, talking about breast is not considered a very, very dignified thing. Women hesitate to talk about it. Women feel shy to talk about it. So there are many factors wherein the delay of diagnosis happens.
Sometime back, I read somewhere that every 24th woman in the country is affected by
Yes. So 1 in 23 women are expected to develop breast cancer sometime in their life. Yes, it is growing rampantly in our country, and being aware is the way forward.
Madam, what is the reason for this breast cancer?
Right, so I cannot say that there is one particular reason. It is multifactorial. There are many, many factors which come under play, but there are certain risk factors which I think we should talk about so that it helps most of the people. Now, some of the risk factors are, see, basically breast is an organ which is well developed in a woman, and the function of breast is to secrete milk and to nourish a young child.
Sure.
Now, for some reason, if this function of the breast is not fulfilled, such a woman is at higher risk of developing this disease. That means women who do not get married, or women who get married but do not have children, you know. We see these days by choice couples don't want to have children, you know, or women have children but they are not able to breastfeed, you know, whatever the reason is. So breastfeeding a baby is what I would certainly recommend all the women. Please breastfeed your children for as long as possible, at least for 1 year. Breastfeeding is actually protection for the mother against breast cancer. Another risk factor is when the first child occurs after the age of 30 years. That is again a high risk factor. Obesity, alcohol consumption, smoking are again very strong risk factors, and smoking amongst women or alcohol in women of India is on rise. I'm sure all of us have noticed it. Yes, it has, there is a high price to pay.
But is it more in urban area, madam, not in rural area?
Yeah, that's true. Also, breast cancer is more common in urban women than in rural women. It is a lifestyle related disease. Obesity is another factor. Not having a sedentary life is another factor. Indiscreet use of hormone tablets, you know, long-term use of oral contraceptive pills, you know, or HRT, hormone replacement therapy. So women, whenever any hormone related tablet is used, whether it's an empty pill or I pill or oral contraceptive pill, just do not go to a pharmacy and buy it on the counter. Please go to a doctor, let the doctor prescribe to you, let the doctor understand what is safe for you, and only those need to be taken. And Another risk factor is 5 to 10% of breast cancer runs in the family. That means there is a faulty gene which is being passed on from one generation to another generation. And now we have a method to detect whether a particular individual has inherited that from her parents or not. We can do a simple genetic test, which is a simple blood test. It is available in India and it is also at an affordable cost. Earlier days, we used to send these samples abroad and it was exorbitantly priced, but now this is available. And if there is any strong family history, I would urge that get a genetic test done, because there are a lot of things that we can do before the cancer develops. We can take appropriate action.
Madam, how do you compare this with other countries, developed country and our country?
Oh, there is a vast difference. In fact, in the developed countries, the incidence of breast cancer is higher. What do I mean by incidence? The number of cases seen are higher than in our country, but unfortunately, the number of deaths is higher in our country.
Because of no
treatment? It is not because of no treatment. We have everything available in our country. In our country, there is nothing that we cannot do what can happen in the best centers in the world. But there is lack of awareness, and as I already said, women come to us. More than 70% of women reach the doctor for the first time when the disease is already in an advanced stage. Whereas in the Western countries, because of awareness, because of the way they live, most of the women are diagnosed in stage 1 and stage 2.
That is early stage.
Early stage where cure is possible.
Madam, recent development of different therapies in treatment. How do you look at it, madam?
Right, so there are many therapies coming up because we want to first of all increase the rate of cure, we want to decrease the price, we want to make it affordable for everybody. So there are many things which are being considered and a lot of therapies are coming up. I would just like to say that it's fantastic, research has to happen, there is no doubt about it. But I personally would recommend that we follow what is called as evidence-based medicine. So whatever we are prescribing today, if I say as a surgeon that one particular kind of surgery is better for a patient than another, I don't say it just out of my experience or something which may be limited, I'm saying this because there is a vast research which has gone, there has been clinical trials which have done on millions and millions of patients all over the world from different ethnicity, and then with long-term follow-up it has been proven that this particular medicine or this kind of surgery is better. That is called as evidence-based medicine. So newer modalities of treatment are welcome, but we need to do what is called as a clinical trial and prove that yes, this is safe method, this is far more, we get better results, and that is when we need to use.
Madam, when you think of therapies, the only thing that comes into our mind is whoever is first administered with this chemotherapy treatment has got various side effects, madam. What do you say about that?
Sure, there are side effects, but we have come a long way in oncology, especially in breast oncology. In fact, when I was studying as a student, several years ago, the kind of side effects we would see were very high. Patient would feel the treatment is worse than the disease. But no, it is no more like that. Chemotherapy drugs, there is so much advancement that has happened, so much research has happened, such better drugs are now available that it is first of all tolerable by most of the patients. Whatever side effects are there, they are only temporary. As long as the treatment is given, the side effects are there. And once chemo is stopped, patient comes back to normal, and they are very tolerable. We have given chemotherapy for very young patients, very old patients, even in 80s, and it is tolerable.
Is it necessary that in every case that therapy has to be given?
No, there are various different methods. There are many factors we consider before planning the treatment of whether it is surgery, chemotherapy, radiation therapy, hormone therapy, immunotherapy, targeted therapy. There are many kinds of treatments available, and there is no one size which fits all, because breast cancer also is having a lot of varieties, sub-varieties. Not all breast cancer is alike, hence treatment is also not alike. There are many factors we need to consider before planning. There are also a lot of people where chemotherapy is not given.
And there is a lot of discussion goes on that protocol treatment, that there is one standard only is followed. But don't you think that it differs from patient to patient?
Oh, 100% it differs. First of all, we need to find out what is the kind of the breast cancer we are dealing with, what is the sub-variety of it, what is the age of the patient, do they have any comorbidities, what is the configuration of the patient. There are many things that we need to consider before we start the treatment.
And what are the recent breakthroughs, madam, that has come in this treatment world over?
Yes, world over, like I said, better chemotherapy drugs have come up where the effectivity is better and the side effects are lesser. All right. Also, targeted therapy, what we call, has come up, especially in HER2 positive breast cancer. There is a lot of research which is happening also in the arena of hormone positive breast cancer. There are many oral drugs which have come up, which is very effective and also very convenient for the patient. Better radiation therapy methods have come up where the radiation is targeted to the tissue and rest of the normal tissue is spared. Better surgical techniques are available now. One of the fears which women have, especially in breast cancer, which I think is not only a scientific issue, it is also emotional and a social issue, according to me, breast cancer. Very often in India, we see a lot of young women who develop this disease, and it raises a question of femininity, motherhood, and a lot of things which is also extremely emotional. One of the fears that women have is that if I'm diagnosed with breast cancer, my breast will be removed. I will not even look like a woman. My femininity would be lost. I've seen a lot of women. What is the use of me living such a life? And on other side, I'm telling you also that breast cancer is curable. That means they have a long life, and hence surgical techniques have improved so much where we not only clear cancer from the body, but we also give a good quality of life for the woman by doing organ preservation surgeries, which is called as breast conservation surgeries or breast reconstruction surgeries, oncoplastic surgeries, wherein not only is breast cleared, but also the femininity of the woman, the cosmetically also the woman looks neat, and which adds on to her confidence to live a normal life.
Madam, how about this alternative medicine in breast cancer therapy?
Yeah, there are a lot of alternative treatments which are coming up, especially in our country, wherein it is also welcomed. We are very open to it. But like I said, yes, under the clinical trial, we need to do it, prove the effectivity of it, and then put it into the practice.
And what do you think about the possibilities of integrated approach in treatment?
Certainly, we already have that in the sense, at least in our department, we have a wholesome department, I would say, not only surgically, chemotherapy, radiation therapy, we have a psychologist on board, we have a lymphedema expert on board, we have yoga, meditation is what we certainly recommend. Nutrition is extremely important in my opinion. De-stressing yourself and keeping your mind calm is equally important, which adds on to healing. So these are certainly welcome, and we also have an NGO of our own which is called as CREST Foundation. CREST Foundation stands for Cancer Research, Education, Support and Treatment Foundation, wherein our goal is to reduce the burden of breast cancer in our society. That is our aim. So as the name suggests, research, yes, we are doing research in our own way wherever it is possible. We have a very stringent collection of the data. Only when we have strong data can research happen. So we're doing that. We publish papers and we audit our own work. Whether our outcomes are at par with any other big center is what we do with the help of data. That is about research. Education, we do a lot of awareness programs wherein we teach women the importance of knowing breast cancer, importance of breast self-examination, mammogram, etc. We have reached out to close to 5 lakh women so far by our programs. Also, we are supporting underprivileged medical students to complete their education who are meritorious but underprivileged. And as far as support is concerned, that's what I was coming to when you said integrated approach. Now, support is, we have an organization within Brest which is called as 3. 3 is support to heal, restore, empower and energize. This is a group of breast cancer survivors. These are the women who had breast cancer in the past and today they have leading a normal life post completion of the treatment. So it is an organization of breast cancer survivors who emotionally support the newly diagnosed patient of breast cancer. So that is what I'm talking about, the integrated approach that we are having as far as breast cancer is concerned. And I truly believe in the teamwork, which is extremely important.
Madam, you referred one point in this, that is regarding yoga. Madam, yoga we have seen, especially in our country, you can take me also because I'm nearing 70 now. Many people who are practicing this, our Prime Minister practices yoga. Hale and healthy people are those who follow this. How much role it will play in the coming days, especially now that about 196 countries are observing yoga, and it is rapidly growing, and many say it is about $2 trillion it's earning for the yoga community. But how to relate this to this particular disease?
Right. So, like I said, there are many studies which have shown that women who are physically active, who exercise regularly, have reduced risk of breast cancer. Or those who have already had breast cancer, the chances of relapse are lesser. And in my opinion, I'm not an expert in yoga, but what I understand is that yoga is not only for your physical exercise, but it also calms your mind. So it is a kind of a therapy for your body and mind. And that's extremely important. Like I said before, to de-stress ourselves, to keep ourselves physically fit is extremely important, and there is scientific evidence for that, and which can be better than yoga and meditation, which comes from our country, and we are proud about it. I would certainly recommend that, and I recommend to all my patients to start yoga and meditation. There are many people who are ready to teach this. It can be even done online these days, considering the pandemic, and we should certainly avail that opportunity.
Madam, how much in the treatment part the role of psychosomatic analysis is considered, madam?
Oh yes, it's very important, and as oncologists, unfortunately, we have to break the bad news to the patient that you are suffering from cancer. And if you think of how it lands on that particular person, it is devastating, I'm sure. And the taboo associated with this word cancer, or the big C, is so much, that it is psychologically extremely devastating, is what I would say to the patient, and hence counseling is very important. It's a major aspect. There are special onco counselors who are trained in counseling the oncology patients, and so we ourselves try to do as doctors, but of course we also have limited time, and counseling takes a long time. But personally, in our department, we try to do it ourselves, because there is a connect which happens between the patient and the doctor, and of course there are counselors whose role is extremely important. The family member's role is also extremely important, the caregiver's role, because what the patient needs at that particular time is a lot of emotional support, to go through the therapy, to accept first of all that I've got this disease, and I need to take the treatment. And the worst are patients who are in stage 4, where we're just trying to improve the quality of their life, For them, palliative is extremely important, and a psychological support is very important.
Madam, I felt many times, because though if you take today, I'm nearing 70 years, madam, I saw many great doctors in the olden days, especially 30 years down the line. It was very less talking about medicine and treatment, and they were talking more about, most of the positive things.
Yeah.
I can quote, they say, "Arey kuch nahi hua tumko, you're all right, don't worry, we'll take care." These words actually really help, madam.
Yes.
What do you think, madam?
Oh yes, see, we all live on hope, isn't it? Imagine if we didn't have hope for tomorrow, what is the use of being today? So hope is something, and it is not giving a false assurance, because I feel that there is certainly hope in cancer treatment these days, because of so much advancement that has happened. There is hope certainly, and that is what we need to instill into the patients. And it is not only giving them scientific knowledge, or the knowledge of it, but we need to understand from their point of view, how much are they able to assimilate, and what are their family circumstances, and what are the issues that other than this that they're leading with. Especially women, that it's extremely important to have a positive attitude, and that's where I feel the support structure which I was talking about is very important. When they see women who have gone through this treatment and living a normal life, it is very encouraging for the woman who is newly diagnosed with breast cancer. Yeah.
One case I observed, madam, the patient already gone through, your patient only, but I met her very early, Kamal Peter. From our NGO, we have awarded her as one of the best teachers also, and now she is working for a corporate company. She used to work in Kendriya Vidyalaya.
Right.
And later she had this problem, and then she has gone through that. What I saw from her is 11 years down the line she had this disease, but not a single iota of trace in her. So I felt this question, psychosomatic, works a lot.
Absolutely. It's as important as taking chemotherapy or radiation therapy, or maybe more important, I would say. Yes, it's extremely important. And the doctor's compassion, I feel, it plays a big role. The attitude of the doctor also plays a big role. Unfortunately, not blaming anybody, but it's so hard pressed on time, and for a doctor it becomes an everyday job, but for the patient it's the new thing, and somewhere we should bring that compassion, because first of all we are human beings, and then we are doctors, and then we are oncologists, and every time we talk to a patient we need to put ourselves in their shoes and talk to them like what would I like to hear. That does not mean that false assurance has to be given, but it has to be conveyed in a way where they feel encouraged to take the next step of the treatment, and that's very important. Unfortunately, I would like to tell our audience that, and this I have seen, when a patient gets well, for them doctor becomes God. For them they feel you have cured me,
Yes.
you have cured me. But I would like to tell the audience very categorically that no doctor is a god. We are not gods. We are as human as anybody else. We are also doing our job like everybody else is doing. Yes, we are fortunate that we are in this field. That's what I would consider. I'm very, very grateful that I'm in this field where we can make a difference. But it is the science which is there, or I would say it is God which is there, which is actually healing, and we are only the medium. And that is what I would like to convey to all our patients. You know, having gratitude is one thing, but at the end of it, we are as human as anybody, and we also have our limitations, you know. And with our limitations, we try to do our best. We are putting in our 100%, and the goal is to give maximum comfort to the patient who is right now ailing.
Great, madam, and it was very nice to hear that, madam. Your NGO is also doing a great work that we heard. And to sum up, how do you want to take further this, especially in the rural area? Is there anything that we all NGOs can come together and do something?
Yeah, so in breast cancer, first of all, bringing about awareness is very, very important. You know, the women need to understand what are the signs and symptoms of breast cancer, what are the changes that can happen in the breast, which should take them to a doctor and get themselves examined. Please do not feel shy talking about your breast, okay? Breast is not only a sex organ, it is a organ in our body like any other body. If anything goes wrong, please do not hesitate to talk about it and come forward and meet the doctor. Please practice breast self-examination. It's a very, very simple method which you need to do just once in a month. It takes less than 5 minutes. Just go on YouTube and type breast self-examination. Lot of videos will come up, and you need to do it once in a month. All the women who are 40 years and above, please do a mammogram once in a year. Mammogram is a special kind of X-ray we do of the breast, wherein even very, very small lumps or small abnormality in the breast can be picked up, you know. So women, your health is extremely important. Women are the backbone of the family and hence of the society. And I always tell women, if you love your family, you need to look after yourself first, because you can continue to love your family, continue to take care of them, provided your health is taken care of. Thank you so much. Thank you so much.
Thank you, madam, and it was nice talking to you and to all our audience. In the beginning only we have informed you that Dr. Jayanti is one of the lead oncology surgeon, and she represents at this moment Apollo, and she is running her own NGO also. It's a very rare combination, and those who are had the opportunity of consulting her for their relatives or their family members, they all call her the best. In fact, we are hearing from various quarters, right from Bombay to here, that she is one of the best surgeons we have in the country in breast oncology. So, dear audience, thank you very much. We have brought you to Dr. Jayanti, and we want to just give her a small compliment from VDM India on the Move.
Thank you very much. Thank you.